Welcome, friends, to this episode of the Sync Your Life podcast. Today, I have my friend Lilli Correll, the author of Resolve to Rise, Become Greater Than Your Circumstances. We're going to talk all about her book later in the podcast, but for now, I would love to just dive straight in and have her share her story with you. So Lilli, I'm going to let you share your story with the audience.
Thank you. I always start with, I was born in a small town in Massachusetts, just to make it a little bit silly, but it's actually the truth. And it's where my story began. My mom had a very, very tumultuous birthing experience with my sister. I would say probably traumatizing for her, and had a really negative kind of connection with my sister because of that. So when I came into the picture, I was kind of this savior and light. And there was a lot of pressure kind of that was placed on me at a very young age to bring that joy and that elation. I'm a bright kind of personality anyway, by nature. I've always been kind of silly and playful, and that became kind of a requirement in my family. My dad was actually the first man in the state of Massachusetts to gain custody of his children in the state of Massachusetts, because in that state, it actually required a person to have threatened their child's life, which my mom actually did in front of a police officer, for that to happen. And so my father had custody of us, and we would kind of go back and forth because it was primary custody. So we had visitation with my mom. Horrible things would happen when it was just my mom, because my mom had bipolar 1 with psychosis and was not treated all that well. And so at times she thought wars were going on, and she would wake us up in the middle of the night, tell us to get under the table. We couldn't eat the food. It was poisoned. And would, sometimes not be there when it was pickup time. She actually took me with her with a friend when I was supposed to be going back to my dad. So there was just a lot of confusing parts of my childhood, not to mention the violence that my mom inflicted on not just me, but my sister, my father. And so my sense of kind of being this savior and being this person that was always in this upbeat place became like a life-saving mechanism of kind of keeping everybody safe. So even my mom at age 23, I'll never forget it. She called me. She said to me, "I had a dream about you last night. You were 2 years old and you were my savior." And I knew at that particular moment, I thought, I'm going to talk about this in therapy because this is not healthy. And actually did turn into the way that I showed up in relationships as I got older, that I felt this need to be the savior and the person that was on top of everything and stayed in a happy mood. And so as I started to do my counseling work, I started to see that the trauma that I'd experienced at a young age was actually having a big impact on me. And I decided that I needed to start just being honest and working on that. I had been at a fairly young age, around 14, I started using alcohol and even did some drugs just to kind of continue the dissociation that I had been able to do and just wasn't able to do as well. And at 16, I just decided it was time for me to figure out a different way, because I wanted a better life than that. I wanted to be a better person than I was being. So that's really when I started to stop drinking. I actually went to 12-step meetings, got support, and started telling my story and learning that just on a basic level, telling your story and having people validate it and hear it and relate to it makes you realize you're not alone. And that was probably the core thing that kind of launched me into having a willingness to really look at it and work on it, was realizing that I wasn't, uniquely damaged as I had felt like I was. And, it's been years and years of working on it, figuring out things that help, things that don't help, trying different types of therapeutic approaches, doing meditation, changing my diet, and, really learning how to optimize my well-being, that I realized as a clinician too, not just as a individual who suffered trauma, that a lot of therapists out there are actually doing talk therapy with their clients, which is fine, that's nice, but it doesn't change the impact that it's had on your body, your brain. And so you're still triggered by all those things that we're triggering. And maybe sometimes that makes a person feel like, oh, I'm irreparably damaged because I'm seeing this really great therapist and they can't help me. When really there are actually evidence-based approaches out there that actually help to rewire your brain, to help kind of free you up from being in that state of fight or flight, that kind of help you identify, oh, that's a trigger. And so what all I'm feeling and experiencing is actually historical mostly. And so being able to move past that, I really wanted to send that message out to folks from a clinician standpoint, but also from a person who's had that lived experience, to say, hey, you're not irreparably damaged. But I've also worked in healthcare for about 20 years. And so I've seen the healthcare system holistically, and I've seen how the healthcare system fails to take care of people, and how often in any inflammatory disease or in mental health conditions, there's an underlying trauma that hasn't been addressed. And so from that standpoint, not just, again, at an individual level, but holistically, the healthcare system, how can we show up better? How do we identify who are the good providers that are actually doing work that is regarding to the person and helping them heal? And how do we identify who those folks are, make good referrals if we are a clinician? And then if we're the individual seeking care, how do we find people who really line up with that and can help us make that journey?
Yeah. Yeah. So that led you then to, your own practice and writing this book, which I definitely want to talk about later in the podcast. But I'm interested in knowing a couple of different things, and we'll start here. What or who brought about the awareness in you of your own triggers?
It really is an evolving kind of awareness, I think. I noticed in college, I remember one day I was at the pump getting gas, and I managed to leave the pump in my car and started driving off and took the pump with me. And I was humiliated. And I thought, I could not tell anyone that I had done this. This is humiliating. And then I thought, what if I did something different? What if I actually told people and I laughed about it and I had grace for myself about it? So I remember distinct things like that, even as I was younger, of this awareness of how, if I did something that wasn't the smartest, sharpest thing, that I had a tendency to really relentlessly beat myself up and internalize that and just feel overwhelming shame. And that I had a choice about how I responded to those things. So it's been evolving, because I would say in the last few years, I've been going through a fairly challenging circumstance. And I've noticed that even an email that has pointed questions in it can feel like an affront and be triggering. And then all of a sudden I'm in this kind of fight or flight. Oh my gosh, I have to respond immediately, and I have to respond correctly, and I have to, do this right. And realizing, wait a second, this email is just an email. And honestly, when I look at the email separate from the context of my history and this fight or flight response that's getting triggered from my history, it's really not that big of a deal. And how can I navigate that? And how can I have grace for myself that it feels that way? And that, I have that instantaneous kind of response. So it's been kind of evolving, honestly, over time, and just figuring out how I can be compassionate and kind to myself. And most recently been doing some parts work through internal family systems as an approach, therapeutic approach, where you actually allow space for those things that you tend to kind of press down, like where you feel embarrassed or whatever. And you're like, I shouldn't feel embarrassed. I should feel this way. And so you just dive into how you should feel. And really just entertaining, well, what is that embarrassment about? And how is that affecting me? And how am I metabolizing that? And how do I move through that? And really finding a lot more peace even in that. So.
Yeah. I love that you just said should. I have my personal growth coach always says, stop shoulding all over yourself. You've probably heard that before too. And she says that to me a lot. And it's interesting because as a parent now with small children, a lot of times in my head, I'll tell myself, oh, I should or shouldn't do something. And then I look at them and I think, well, wait a minute, I'm actually going to reverse that decision because they're now watching me and what I choose to do in this moment. Right. So I talked recently on a podcast about the death of our dog and how my natural instinct was to just sort of bottle it up and to not show it so that my daughter wouldn't get upset. And then I had sort of this moment where it was like, no, that's not what I should do. I should just let this feeling sit and I should let her see me in this feeling. So I love that you said that and made me think of that little thing that my life coach says. I want to know from you, let's sort of talk on a high level first about trauma. I'd love for you to sort of define trauma for us and what you've seen in your practice.
I really love this. As I was going through, and I do a lot of trauma training. As I was going through this most recent one, I ran across this quote, something to the effect of trauma. Trauma is not necessarily a distinct experience. It's how we respond to that experience. And so if in our response, we reach a space of what I consider overwhelm, where we cannot navigate the intensity and the bigness of whatever that situation is, in an emotionally regulated way, that we've experienced trauma. And I like that. I think most people will say they experience trauma if they see a fatality accident, if they had ongoing abuse from a parent, or maybe even one experience of abuse that was quite jarring. But it really varies from person to person. Like, what situations cause overwhelm to the point of feeling like you kind of have to shut down? And dissociation is such a common symptom of trauma, where you're just kind of disconnected, and you'll see like somebody who's telling you a story about something that you're thinking, this is an awful story, but their affect is completely flat. Or maybe they're even giggling while they're telling this story. There's this disconnect of, wait a second, you're telling me this really awful circumstance, but you're lighthearted. I think, things like that can kind of indicate that, yeah, there's this disconnect. And that is a really good indication that something has happened that has caused you overwhelm to the point where you couldn't deal with it. So you're not. Viktor Frankl, said, the normal response to an abnormal situation is abnormal. So like oftentimes in the United States, we expect people to kind of act as they normally would. Let's say you go through the death of a loved one and they're like, it's been 2 weeks or it's been some ridiculous amount of time, right? It's like, why aren't you better? But that if you acted like you always do when something abnormal has happened, something out of the usual, something that's been really hard for you, that's actually more unbalanced than the alternative of being really not in a normal space for yourself, being out of control, feeling overwhelmed, avoiding driving by certain places because it activates some kind of reaction. So trauma, I think, we always think of abuses and witnessing abuse. Also, I think sometimes there's confusion about that. Like, oh, well, the abuse didn't happen to me. It happened to my sister. So I wasn't abused. That's also oftentimes traumatizing. And then, you hear of vicarious trauma, where a clinician who's listening to people's trauma all day long, every day, that can be traumatizing. Or having situations where you have, you have rescue workers who are going on the scene and it's part of their job. And so how do you calm down a person's nervous system when they're going in and going in and going in to situations that are extremely traumatizing? It comes in all different shapes and sizes.
Yeah. Yeah. It's interesting because, it's so funny to me how this theme of trauma keeps coming back up in my life. And I keep meeting people and experts like you who always give new light to this topic for me. And I used to think to myself, like, well, I've not been a victim of gun violence. I wasn't abused. Like I don't have any sort of like big trauma experience. But the more I listen to experts like you, the more I realize like all of us have experienced some trauma, regardless of what it is, because like you said, it's not the experience itself or the event itself. It's how it impacts your body and your mind and your overall, nervous system. I want to talk more specifically about, how it impacts the nervous system and how, cortisol is impacted. And I want to kind of connect all this to hormones. But before we go there, I'd love to know, just why is it so important to address trauma? But also, what does healing look like?
I think some people, and I have siblings. I don't want to talk too much about them just in case they listen, but I went and did therapy and it maybe in some ways, my trauma symptoms maybe were manifesting in more obvious ways. I think that when you don't do the work, you don't actually necessarily understand how it's impacting you. And it is. So there's this lack of awareness. It's, you're living in behaviors that you've come up with, ways to cope that are not necessarily healthy. And you're just reenacting those things. When you go and do work, you start to get that sense of, okay, this is how this has impacted me. Here are the triggers that happen for me. This is how I react. This is what I need to or want to address. I do think it's important, and it's been, I think, fairly a decent amount of time since they realized that you really don't have to deep dive into the narrative of your abuse. And I'm sure there's clinicians out there who still do, but you don't have to recount, you don't have to sit in therapy and recount the exact thing that happened to you. In fact, that can be re-traumatizing. So I think when I say it's important that you do go and address the trauma, it's really the triggers in the here and now. It's what I was talking about how I'd get this email or whatever, and I'm reacting and I'm upset. And it's like, it doesn't make sense in the current context, like how I'm responding, to start kind of uncovering what is the trigger, what's the reaction to the trigger, how can I start kind of changing the course of that, what kind of intervention makes sense for me. And that's also really important, I think, is figuring out, there's so many different evidence-based approaches out there. And we're kind of all like snowflakes, each one of us has our own sense of what would work for us. How is the trauma manifested in my life, in my body? And what is the right way to kind of start healing? And I think that's really important to listen to too, is knowing as a person that you're an expert on the manifestation of your experience. And there are providers out there who are a little bit more medical model, hierarchical, not what I like to call synergistic in the way that they approach it, not appreciating that you actually as a patient are actually an expert on your symptoms, your experience, how you feel like it's impacting your health, your mental health. And I think it's really important that when you are working with somebody, that it's somebody who regards that. And there's a lot, unfortunately, not just medical physicians, but actually behavioral health clinicians who are hierarchical in their approach and don't do that work. So it's really important when you do seek therapy and you seek to work on this. The other thing is that you can do it personally at home. It's not like you have to go in and see somebody. If you want to read books like The Body Keeps the Score, or obviously my book, Resolve to Rise, that can help give you some insight and kind of kick off the journey of, does this make sense to me? Does it resonate with me? It's kind of like what you were talking about, the universe is bringing you person after person after person, and each person kind of gives you a different flavor and a different like insight about, oh, yeah, that makes sense. It's impacted me in this way. I think that's true too with the literature that's out there, with therapeutic approaches, with to stay curious and to, see what resonates with you and honor that.
Yeah, absolutely. I like that whole concept of you are an expert on yourself. I say the same thing in similar terms, which is you are your own best doctor, right? When it comes to your health, like understanding when you feel off, right, then something is off. And so I think a lot of times we look for like those outside sources to either explain our circumstances or explain how we feel or give us a diagnosis or whatever. And it's like a lot of times it really comes down to you, like you understanding you. So I love that. I love that idea. I'll make sure to link up both your book and that book in the show notes so that people can reference them if needed. But I want to talk more specifically about how trauma, what does trauma look like when it comes to our hormones? Because as I mentioned, I've interviewed different trauma-informed therapists about this concept of trauma and how it connects us and how it manifests in the body and things like somatizing and things that you can do to sort of heal. But I really want to dig deeper into what this looks like, because I like to teach hormone health for women, especially. I like to talk about cortisol. I like to talk about the fight or flight response. And maybe that's a good place to start. So I'll hand it over to you to sort of talk to us a little bit about fight or flight, and we'll start there and kind of work our way through.
Absolutely. And I look to you to jump in there with me because you're obviously the hormone expert. When you are in a fight or flight space, your cortisol obviously increases to kind of help calm things down. And if you're in a constant state of fight or flight, which oftentimes, if you've been through something horrible, if you have experienced, especially what we call complex trauma, right? So in childhood, where you have repeat offenses of this trauma, you can be triggered all day, every day, or multiple times a day. And so your body's in this constant state of fight or flight. That's going to cause your cortisol to be having to show up again and again and again and again. You basically wear down your system. And I think when you just focus on cortisol, you're not really seeing the bigger picture. It's kind of like anything, everything works together, right? So when your cortisol is depleted, it starts demanding more of all of your hormones, right? Your serotonins, your dopamines, your gabapentin, so your neurotransmitters, your progesterone, your estrogen, your testosterone. So often men, I hear this again and again and again, men who have had trauma, who are having health issues, who actually have low testosterone and get that treated. And it's like revolutionary, right? Like just changes the whole experience for them. Like they have energy again. And there's this sense of, oh, I'm not masculine if my testosterone is low. So that's embarrassing, but it's, just as it is for women. So the constant fight or flight is really putting so much demand on your whole system, not just your hormones and your neurotransmitters and your, and so it's just this constant activation that just wears it down. And, there's been times in my life where I've gone to get hormones tested. Actually, in my early 20s, I went and saw somebody, which seemed kind of ridiculous. I'm not like, it's not like I'm menopausal. I had said something to my doctor about I was having difficulty losing weight. I wasn't super overweight. I just, I was changing my eating. I was exercising. And I said, I'm not losing weight. And she said, we should check your hormones. So we did this hormone test. I probably was like 27, 28. And it was through the night, right? So it was like this, I think it was a saliva test. I can't remember. It may have been urine. I think it was saliva. And you did it at certain times throughout the, night. And so we met and she said, the strangest thing, your cortisol is through the roof in the middle of the night. And I said, well, that makes sense. That's when I'm working. And she said, oh, so you work over and I didn't know that. And I said, well, no, I wake up in the middle of the night. I think a lot of us do this, right? With the solution to whatever problem came up during the day. And I said, so I'm like working through the night. And she said, you actually, when you wake up in the morning, you have no cortisol left. I mean, imagine that, like,
you're backwards. Yeah.
Yeah. You wake up in the morning when you need it, because now you're going to face the day and you're depleted. So that was the first awareness. And then it was like, this is how this is affecting your progesterone. And so you need help and support with your progesterone, because while you have progesterone, and if we did a blood test, it would show that you have plenty of progesterone, you're not utilizing it.
Yeah. Mm-hmm.
So that was my first kind of foray in my early or mid 20s to just kind of go, oh, wow, like this fight or flight and having these triggers and all of this is connected together, that it's not like you can say, oh, well, that's mental health. That's, people are starting to say, oh, the head's connected to the body and we need to like think about it together. I actually don't like that expression. I'd rather people say, we're all an integrated whole, right? We have experiences that activate our nervous system. They affect every cell in our being. We have health conditions. It's not like it's just like, oh, I have multiple sclerosis. It only impacts where I have lesions in my brain. No, like it's a holistic, I get inflammation. I have to manage down the inflammation. It's a holistic, it's all connected together. It all impacts, each other.
Yeah.
So very, very important, I think, to stay connected to that. And if you're going to try to really claim wellness and optimal well-being, then you have to look at all of these different dimensions of health, not just your mental health of I'm meditating, or I'm going and I'm getting counseling, or I'm reading The Body Keeps the Score or Resolve to Rise, but that you're taking it from multiple angles to really set yourself up for success, because it has real impacts in your body.
Yeah. Yeah. And that's exactly what I was going to say next is I think I saw sort of a meme floating around on social media recently that said, why is it that we're so willing to like change our hair, do our nails, we go to the gym, we do all these things for like the external appearance. And then we wonder why we don't feel any different. Like our energy doesn't change. And it's like, until you do the deep work, right? Until you do sort of the mindset work and you understand and create that self-awareness in yourself of maybe triggers when it comes to trauma, or maybe it's just even more awareness of your body itself, right? Like I have a family member who's dealing with an injury, and she's not super proprioceptive of her body. And so she'll make comments about, well, it hurts in this place today, and then tomorrow it hurts in a different place. And it's like, even just establishing that awareness of your body and understanding your movements and your functionality and how your body works. It's very similar with your mindset, right? And understanding your brain. Like when you were talking about the awareness that you established and understanding that you tended to maybe disassociate, right? That's a huge life-changing piece of awareness, because now, like for you or for me or for anyone else, I'm in the same way, right? Like I mentioned at the beginning, I'm somebody I would rather internalize. I'm not an outward emotion person. I don't cry a lot in front of my children. I've had to make the decision that, okay, Jenny, like you maybe have been like that before, but now you have the awareness that this is what your children need to see, or they need, this is what you need to feel. And so, or being okay with the feeling itself. So I love that idea of like doing the deep work. And I do want to circle back briefly to the cortisol, because this is sort of my soapbox area, but I see a lot of women, who exactly what you described, right? This sort of what I like to call backwards cortisol situation. A lot of times they'll say, oh, they'll laugh about it. I think a lot of women do laugh about a lack of sleep, as being like, oh, I'll sleep when I'm dead. Ha ha ha, whatever. I think too, women who are mothers of small children, I have a 5-year-old and a 1-year-old, and I totally understand that you have to laugh or you'll lose your sanity, because your sleep schedule is pretty much determined by the sleep of your children. Same thing. And I'm just going to say the same thing goes for my husband too. He's not out of the ballpark there. He also has to help. But, when it comes to that, like, I know for me, I was always a really good sleeper and my circadian rhythm was always great. Then I had children and it was just totally turned upside down on its head. So the exact same situation as you, where I felt like even when my children did start to sleep through the night, I was then waking during the night. It's almost like they set me up on this pattern for like frequent nighttime wakings. And then I would be up in the morning and I would feel like there was not enough coffee in the world to get me going for the day. And so this happens. And what she's talking about is usually what's called a 24-hour cortisol saliva collection. So you do something, whether it's sometimes overnight, sometimes daytime, sometimes both, where you're literally just collecting saliva over the course of the day to see if your cortisol pattern is falling in alignment with where it should. Your cortisol should be the highest in the morning. So you should have the most energy when it comes to cortisol. You should have that sort of wake up response in the morning. And then as melatonin starts to kick in later in the evening, you should follow the sun, basically. Like as the sun starts to go down and your melatonin comes into effect, you should start to get sleepier and then have that good night's sleep. a lot of Americans, whether it's dietary, trauma related, stress related, there's so many different things that are factored in here that can really screw up your entire endocrine system, right? We talk about on this podcast, the way I teach with my sync courses, we talk about the 4-legged hormone chair. You guys that are listening, you're aware of the fact that if your cortisol is off, that's one leg of your chair. If you saw off a leg of your chair, your entire chair becomes wobbly, right? And so like she's mentioning, your cortisol then affects it starts to steal energy from your sex hormone. So then your sex hormone leg of the chair gets wonky, right? And the whole chair starts to wobble. So this is super important, because if we're not willing to do the deep work and we're not willing to understand what the triggers are for us for a fight or flight response. And I think I do want to clarify too, that fight or flight doesn't always mean, I think a lot of times we'll say, oh, back in the day, if a bear was chasing you or a lion was chasing you, your cortisol would rise, which, by the way, simultaneously, your blood sugar also rises for those listening. So another leg of the chair is impacted as well. And we know that blood sugar imbalance also tends to be one of the top 2 causes of hormone imbalance in general. Side note. But anyways, we don't always have a bear chasing us anymore these days. However, we have screens, we have notifications, we have, lots of demands that society puts on us and that we put on ourselves to always be on alert, right? I was with a person recently and I swear they did not go 2 minutes without checking their phone. So our bodies are kind of in this constant cortisol production. And the more cortisol that's being used up, the more you're depleted, the more backwards your rhythm gets, the more it starts to steal from those other legs of the chair. And the more that's, obviously the chair gets more wobbly. So this all does matter. And it all starts with a simple choice, I think, in making the decision to understand your stress, to understand what those traumatic triggers are for you and how your body and mind respond to those, and making the conscious effort and decision to maybe make a different choice. I mean, it really is. I know it sounds crazy, but it really is that simple. I'll give you another example. I don't want to take up the time from you, but when I was in my 20s, and I also do advocate that people do investigate their hormones in their 20s, even if you are feeling good. Because then you have something to compare it to for later. But when I was in my 20s, we owned a gym for about 6 years, and I was training boot camps in the morning, boot camps in the evening. I was going nonstop. I mean, I was extremely lean, low body fat percentage. I just felt like almost like a beast, right? And for those 5 or 6 years, I felt like the fittest. I was in the fittest shape of my life. I could work and function on little sleep, 5 to 6 hours of sleep. And then immediately around the time that my daughter was born, and again, she starts to disrupt the little sleep I was getting, everything started to go haywire. And I say that because a lot of times what people don't realize is cortisol is something that catches up to you as well. So when we talk about something like adrenal fatigue, and we talk about people who wear out their adrenals, I know a lot of women listening to this podcast are women who train, right? Women who exercise. Exercise is a stressor on the body. Is it good for you in moderation and in the right way, right? Yes, you want to be exercising. However, I think a lot of women it's their escape, right? Like I know for me, I mean, I can say that as myself. I raise my hand to say, I think I use exercise as as therapy in a way, sort of like as a stress reliever. And as good as that might be to a degree, it can also impact your cortisol long-term. So for me, I remember an apothecary pharmacist telling me when I sat down with him, I was like, I don't understand. Like, I've been training and everything's been fine. And all of a sudden I'm crashing and I don't know what's wrong. And he was like, well, what have you been doing for the last 3 years? And so he didn't want to know like what my day-to-day was now. He wanted to know, well, what's the last 3 years? Okay, well, in the last 3 years, I've had a newborn. I was training boot camps 5 a.m. to 7 p.m. And he's like, oh, girl, like your adrenals have crashed. Like they are finally raising the white flag saying you're done, right? And so I say this and I share these stories because there's somebody listening to this that needs to hear it. There's somebody who's listening who's like, ooh, I am burning the candle. I'm feeling off. My sleep is off. And there could be some sort of underlying trauma there for you, or underlying triggers that could really benefit you to know and understand. Do you agree?
It makes me think of, in the very last trauma training I did, there was a point where she said, be curious and not furious. And, I think about like, oh, you're frustrated and it's like, why am I crashing? And as opposed to stopping and going and talking to the apothecary and figuring out how, being curious about it, like what's going on, like how much more you can find out, and and how much wisdom, actually, not just with the apothecary, but within ourselves. I think you referenced that earlier. We have, if we're curious, if we stop, we slow down, we quiet ourselves, we attune to ourselves, especially when you have small children, we're attuning outwardly 24/7 to slow it down for just a few minutes and to attune to ourselves. What am I experiencing? What am I feeling physically, emotionally, mentally? What am I thinking? And being curious about it rather than judging it. I think that's so powerful. Like, just, you slowed down for a moment and you went and talked to somebody else and you were curious and you found some stuff out. It made perfect sense. I'm sure at that point you were like, yes, absolutely.
Yeah, it makes sense, but you also don't want to admit it, especially as a strong female. You're like, that can't be it. Like, I'm like,
I'm unstoppable.
I'm unstoppable. Like, I'm the girl that carries 45 grocery bags in one trip. Like, I can handle it. And a lot of times it's like, yes, you could handle it, but can you handle it better? Can you handle it in a calmer way? Can you handle it in a way that doesn't impact your body? One thing I wanted to mention too, because I do think that so much, whether it pertains to our physical fitness, or we can say mental fitness, I really think everything starts with awareness. And I know that's been the case for me. I always say, I think John Maxwell's known for his statement, you don't know what you don't know, right? And so if you can sort of become somebody who is curious, if you can sort of instill habits for yourself that help you to be curious. And that's what I wanted to say. Was one thing I started doing around that same time that I was training in the gym and kind of wearing 50 different hats at one time, is I started journaling. And journaling was a huge help for me, because even though it was like 2 minutes at night, I would write down, I actually had one that I had gotten from a bookstore, and it had like little, kind of like ad libs that you could fill in and things to think about. And it said, every day you had to write down, like, what's something that I struggled with today? What's a small win from today? So you kind of have these lists of questions. And it's interesting, once you write down the same struggle, like multiple times, only maybe in different ways or different stories, you start to see a pattern, and you start to say, like, why do I struggle so much with this? Right. And I learned very early on for myself that control tends to be my number one struggle. I want to control my circumstances. I've talked about this before on a podcast where I had a unique experience in my sort of preteens. My dad was diagnosed with cancer. It was a very sort of sudden thing that happened. Like, he came home one day and was sick, and then all of a sudden was given 2 weeks to live. And then my parents moved across the country for a bone marrow transplant. And like, our whole world was just totally turned upside down. And when I think back to, I think I was a pretty free-spirited child, no care in the world. And then that age 12 situation happened for me with my parents. And it was like, I tell people now, I'm like, it explains so much for me, because I had to grow up real fast. And I had to be sort of a mother to my brother. We had different caretakers come in and take care of us while that my parents were pursuing his health, his treatments. And so that led for me into this sort of sense of control. Like, I have to control the situation. I have to help control my brother. I have to help control. And then leading into my 20s, right, the same thing was true for my health. It was like, I realized that cancer is sometimes out of our control, but I didn't want to be in the hospital. Like, I had that whole experience of like constantly being in the hospital and being around sick people. And I was just like, I'm going to do everything that I can to control my health. Right. And it totally makes sense. Like, when people say now, like, how do you stay so motivated? Sometimes I'm just like, I don't even know how to answer the question, because I'm like, I don't know. Like, how do you not, but then I think back to my experiences, and I think back to what sort of built the framework for me, probably came out of fear. Right. It probably came out of fear for what I couldn't control. So yeah, once you start journaling things and you're like, oh man, I seem to struggle with control, or I seem to struggle with sitting still. That's been a big one for me. Like, realizing that taking time to sit, or being frustrated with myself that there's no ROI on sitting around, right? Like, that's something that I'm like, oh, but why are we all just sitting here? So certain things like that. I'm like, these are things that are good for me to know about myself, because then it helps me in that moment to say, this is okay. Like this is okay. And Jenny, don't freak out. Like this, you're going against your nature, and it's what you need right now. So anyways, I don't have a question around that necessarily, but I just want to say that if you're listening to this and you're thinking, where does this start? Maybe something as simple as reading the books that Lily's recommended, or journaling each night and thinking about what did you struggle with today, and where did you succeed today, right? Give yourself a pat on the back too, but helping yourself understand what those struggles might be for you. So cool. Okay. So I want to make sure that we touch a little bit more on this idea of healing. And I love really talking about how stress in particular impacts the body. As someone who I used to personal train people in person, not just virtually. And when people would come into my gym, it might sound crazy to some, but you can see the stress on people's body. Like and I'm not just saying that as some sort of like witch doctor woo-woo person. Like I'm telling you that, you can see it in the tightness in their hips, or the constant shrug of their shoulders, right? You can see where people carry stress in the body. So what I want to know from you is just, what have you seen as it pertains to working with, because I know that you're really digging deep into their mind and their headspace, but what do you see as manifestations in the body? And then how can we work to sort of minimize those effects of stress in the body?
I think one of the things that's so common is people stop breathing deeply. And you probably see that when people come in and there's this kind of shallow breathing. It's like almost a scarcity mentality. Like, I'm just going to take little breaths or whatever. It's like not these cleansing, like, breaths. People also kind of at times avoiding eye contact, or like I was saying, there's this disconnect with, I'm telling this story that's really upsetting, but I'm laughing while I'm telling it, that there's this, just a disconnect. We call it incongruence in therapy, that your story is not congruent with what I'm seeing on your face. And then I agree with you, the shrug, shrugging shoulders, tensing up, folding into yourself, Indian style, crossing every part of your body. And that's why I love therapies that incorporate somatic experiences in the body, whether it's, mindfulness or meditation or epigenetic counseling. They'll create like these meditations where this parent or whatever comes into the room, and what do you feel in your body? And I had done some work not that long ago, and I had this sense of like I was pushing back in my chair and leaning my head away as my mom was coming towards me. And I realized at that point that I was doing that because I was going through a really stressful experience. And I sensed that my mom cared about that, but that if I looked at my mom, she'd be upset by my stress, and I'd end up taking care of her. And the therapist said, what I think we mistake about boundaries is boundaries aren't about keeping other people out. They're about keeping us in. That really resonated with me, because as I was leaning away, I wasn't concerned that she was going to move in on my space. I was concerned I was going to take care of her. And I think that there is a lot of that, like in what you described with your situation in your family, of you had to step up, you had to stop being 12 and you had to be 22 or whatever, right? And step up out of that space of kind of dependence a little bit, moving towards interdependence, to I'm responsible, I'm accountable, and that stuff manifests, like you said, in our bodies. So where we tighten up, it's like you're carrying a load, right? Like you're carrying this emotional load, but you're like physically, your body is kind of getting ready to carry this load and to kind of stand up under it. And so I think it becomes really, really important to do that quietening. I think meditation is really great. I don't know about you, but I have a brain that's on fire all the time. So doing like listening to oceans and silence, for me, I can do it now some, but when I first started doing meditation, I could not do that because I was making my grocery list. I was, whatever, I was solving my problems from the day. I have to have somebody kind of guiding me through breathing and what I'm focused on, Sharon Salzberg has a couple of really great meditations out on YouTube that I really like for that. But I think shallow breathing, honestly, is the first thing. And I even notice for myself sometimes when I go, okay, think about taking a cleansing breath, it feels different, right? Because I haven't been, that's not how you normally breathe anyway, but it's just, having that awareness of that kind of starts there. And then you kind of can settle into your muscles and what's going on in your body.
Yes, I'm so glad you went there with the breathing, because one of the things that I offer in my course is we have a breath workshop led by my yoga instructor who specializes in breathing. And she's also a good friend of mine. And she's constantly telling me, in stressful situations, like I messaged her last week explaining what I was going through, and all she wrote back was breathe. And it's interesting because I know for me, yoga especially shows me how I'm holding on to my breath, because when I'm lifting weights or doing cardio, you pretty much have to breathe, right? Because your heart rate's through the roof. But when it comes to yoga, when you really slow down, it's interesting how many times you find yourself in a position where you're holding something, you're holding a warrior, you're holding a pose, and your heart rate's not necessarily through the roof, but all of a sudden you're like, why is this so hard? Why is this so hard? And then you realize, oh, wait, I'm not breathing. Like if I would just take a breath, I could get oxygen to the muscle. And if I could get oxygen to the muscle, it wouldn't be as painful. And that same analogy goes for life. It's interesting too, because I can't help but think my daughter has been in swim lessons this week. And she was at the beginning of the week, she was, she knew how to swim heading into lessons. She learned how to swim last summer, but now she's gotten really interested in knowing how to stroke swim and how to breathe and turn her head to the side. And watching a 5-year-old do that was so funny, because she and I saw this man practicing for his triathlon at the pool one day last week. And he had just been biking, he was drenched in sweat. He comes to the pool and he takes his shirt off and he jumps in the pool and he starts to swim in laps. And of course, it was the most graceful swim, right? Like there was hardly any, there was just a little flutter kick, and he's just nice and methodical with his arm strokes and his breathing with his ear turned into the water. And I remember my daughter looked at me and she goes, Mama, why is he not splashing? she thought that swimming was supposed to be this like thrashing of arms and struggle to breathe and all that kind of stuff. And so we started lessons this week with the stroke breathing. And the beginning of the week, she couldn't get it. And I remember like the first, the teacher was having her swim the width ways of the pool, and she would get to like halfway through and just stop and put her feet down and kind of stand. And the teacher was like, breathe. You have to breathe. Like you cannot swim 6 strokes at a time or 8 strokes at a time. You have to come up for air. Obviously that's the case for swimming, because we are not meant to breathe underwater, but the same thing is true in our day to day, right? Like how many places throughout your day are you finding yourself holding your breath? Bedtime at our house is a highly stressful time. Both girls resist bedtime, bath time, all that kind of stuff. You feel like you're like literally wrestling alligators to get them to bed. And I noticed for myself that I would sometimes even get a headache in the evening. And I thought, why am I feeling like this? Like 7 o'clock at night, my shoulders go up and my head starts to hurt and everything starts to happen. And you're like, okay, well, maybe if I breathe and I bring the calm to the situation, maybe it will also help them calm. And it's been a huge shift for us. But,
Awesome.
I've mentioned this too, for like, I hate flying on an airplane. And I remember telling my yoga instructor, my friend, Jen, like, oh, Jen, we have this big trip coming up. We were going to Italy at the time. And I was like, I don't know how I'm going to make it on the plane. And she was like, you're going to breathe. You're going to recognize when you're holding your breath and you're going to breathe. Same thing goes for at the personal training studio, right? I had men and women come in. You tell them, to pick up some weights. We're going to do some dumbbell curls. The person who's able to finish the exercise, finish the 60-minute interval, is the person who paces themselves, who breathes, who just continues to set a good rhythm with that exercise. The person who's straining and holding onto the breath always has to drop the weights. And so it's so true. So I'm so glad that you mentioned that. I want to touch on, because we have talked briefly just about my children and whatnot. I want to talk about how we as parents and adults, how do we bring our traumas into our parenting?
I actually have been learning a lot about that because of this epigenetic class that I was taking. I got to do a 30-week course with a group, and it's really fascinating. They actually did studies where they found that like with these mice, they had mice where they paired cherry blossom smells with an electric shock. And of course that causes distress. And pretty soon they take away the electric shock, but the cherry blossom smell is creating this anxiety and stress in the mouse. The mouse had pups. The pups had the same reaction to cherry blossom smell. They had grand pups. They had the same reaction to cherry blossom smell. So there's this epigenetic, encoding in a way of the trauma on all of us. There were also women who were pregnant during 9/11. They had in some way been connected to 9/11. They checked the cortisol levels of the babies that were born. They had cortisol levels consistent with PTSD. So it's there's these things. Also the fact that your child has, or you have your ovaries, or you have, when you give birth to your child, they have their ovaries. Like, it's like, there's this like actual, like where you're all together as mother, daughter, future child, if you have a grandchild. So that's kind of fascinating, right? How all of that experience is actually happening on multiple levels at the same time. It's impacting DNA, it's impacting the experience, but there's also the way that we show up. What I learned about myself, it's always fun, right? As a parent, when you learn, oh, shoot, your children are adults and you're like, I kind of wish I had done that differently. I thought I was doing like a really good job, but maybe I wasn't. I wasn't great at making boundaries, right? Because I was a savior. And so what would happen is I would need something and I would expect other people to just fall in line with what I needed. And if they didn't, because I wasn't attuning to myself, I wasn't listening to myself to figure out what I needed and asking for it, I would get frustrated. And so it was kind of like I was expecting people, even in my parenting at times, for my children to do what they should do, as opposed to like, and not that I didn't put them in timeout and that there weren't boundaries. It was just that it was like, it was a personal affront in a way at times.
Mm-hmm.
And so instead of my children just not doing it because it's not allowed, now they're not doing it because they're taking care of my feelings, right? Because when I do this, it hurts my mom's feelings. When I do this, it upsets my mom. I don't want to upset my mom. So in epigenetic counseling, there's this idea of the love flowing from mother to child to grandchild or whatever. It's like down the stairs, right? You're at the top as the mom, your child's down the stairs. And then if they have children, their child is down the stairs. So the love should flow downward, right? Like if there's water flowing down. What happens when there's trauma or, repeat stress that's been passed on is that sometimes the love gets reversed. Now I, as an adult parent, maybe am taking care of my parent, and my children in these subtle ways are taking care of me because I'm letting them know it hurts my feelings. It hurts mommy's feelings when you run in the street or whatever, right? So I had a recent awareness where I had actually said to my daughter, it hurts my feelings when you can, let's say, continue, I don't remember what it was, continue to ask for something when I've said no. At which point I realized that makes her responsible for my feelings, as opposed to just saying to her, don't do that. Like, we're not going to talk about this anymore. It lets her know I'm the big person, and it reverse orders and helps the love flow. And so what I've realized is that it's actually not all is lost because my children are adult children and now I've screwed it up and all the genes are passing on and we're all destined for, I can change the way I show up with my adult children, actually, and I can change the flow of the love so that I'm not communicating to them in a way that makes them responsible for how I feel. And that seems like, if you think about, you're in a therapeutic setting, right? And it seems like to say, Susie, it hurts mommy's feelings when you do this. That seems healthy, right? You're like, you're saying, when you do this, it hurts my feelings when you do this. That's like standard language. That's great for your spouse. That was really an aha for me because it makes sense. Once you think about it, it's like, oh yeah, it is making my child responsible for how I'm feeling. And she does seem to feel responsible, because then I'd notice that she'd say, I didn't want to hurt your feelings, so I didn't tell you this. Right. And it's like, so now I'm not a safe person to go to because I've made her responsible for my feelings.
Yeah.
So that's I
That's
mean,
power.
it can show up in a lot of ways, but I think that's a really common way that it shows up.
Yeah, that's really powerful stuff. And I think I was speaking with someone else recently, and we were talking about just on a basic level, like how your children pick up on your nervous system responses, right? Which kind of comes back to that story I just shared of bedtime. Like maybe if I come into this calmer and with deeper breaths, maybe my children won't be so crazy at bedtime. But both of my children are adopted, and I was adopted at birth as well. And my youngest, is 18 months old now. And when she was born, we dealt with some lip and tongue tie issues, and we started seeing, thankfully, because of my own journey and functional wellness with my migraines and my hormone health, we had kind of transitioned more into functional wellness, and started taking her to a pediatric chiropractor in addition to our functional doctor. And we started her on MFR therapy and all these different things for her mouth. And these holistic practitioners, it was interesting because all three of them, the chiropractor, the MFR specialist, and our functional doctor, all three said at one point, well, she's dealing with trauma, like that her body is dealing with trauma. And it wasn't necessarily pertaining to like the lip and tongue tie, but they were like, do you know if her birth mother was experiencing trauma, or was there any trauma there? And of course, as is the case in a lot of adoptions, it's not like we were not on like a super personal basis. So I don't know a lot of the story or the backstory into Sutton's, in utero experience. But I remember the chiropractor telling us like she was in trauma in utero, and we didn't have that necessarily with my first one. And so it was a process, like the first, I would say 6 to 8 months, we really had to do a lot of work. She was a super unhappy baby, like just screamed all the time, unhappy all the time. And of course, part of that was due to not being able to eat properly with her mouth. But now, if you see her, she literally smiles 24/7. She's just the happiest, calmest baby. And I remember thinking, like, in that situation, I felt, coming back to my own feelings, I felt so out of control, which we've just talked about, my feeling of wanting to be in control. I felt so out of control because this is something that she's brought into the world and brought into, right, our family. And it's something that's genetically there from her experience that I then don't know how to handle, or I don't know how to impress upon her. So thankfully, thanks to things like our functional wellness doctors and getting her on the right supplementation as a baby, and getting her on these different therapies that we've been able to do with her, we've seen such a transformation in her. But it's been a process for me too, to just see, like I didn't carry her in my womb, but at the same time, she's mine. And so how does my nervous system and my responses and how I act influence her? And of course, as she now enters toddlerhood, we see that even more, because as you know, when they're this age, they want to repeat everything you say, everything you do, every little tiny behavior. So it's interesting hearing that. And I like this idea of just sort of epigenetic therapy and working through that. I think that's interesting. So what would you say to somebody who's listening to this as we sort of wrap things up? Like, what would you say to somebody who thinks to themselves after hearing this, okay, this is something I need to investigate for myself? I mean, obviously we've given some things on what you can do easily from home: meditation, journaling, reading these books. But if somebody is ready to sort of seek a therapist, what's the first step?
First of all, anybody, pretty much, if you have a class on trauma, you can say I'm a trauma-informed care provider. That doesn't mean that they're showing up differently. And there is a difference. So the fundamental difference is this idea that hierarchical, I'm the clinician, I'm the provider, I know what's best for you, is not trauma-informed care in the heart of what trauma-informed care was meant to be. It's meant to be coming alongside of you. Oftentimes in healthcare, you'll hear people use, we have to target these patients and manage them. Well, I keep saying nobody wants to be managed, right? We want to be supported. Mm-hmm. It's the difference between I'm telling you what to do, I know what's best for you, you clearly don't, versus I'm assuming you've done a lot of work on this yourself. You want to get better. That's why you're here. I'm going to come alongside you. I'm going to learn from you. You're going to learn from me. We're going to figure this out. So that's first and foremost, that's the primary thing. In the back of my book, and actually on my website, www.resolvetorise.com, there's a resource page, and there is a table. It's not the prettiest thing, but it does show various types of evidence-based practices. It tells you kind of what those evidence-based practices are about and what you could expect if you were to go see somebody for therapy. It also has a list of books. If books are of interest, you can click on the link and get the book from Amazon. But the idea being that how it's manifested in your body, how you've experienced it. That's why I was really interested in internal family systems, because I really felt that sense of parts of me. There's a part of me that feels really rational and thinks this is how I should respond. There's a part of me that feels really anxious. And I really related to that. And I was like, I'm really curious about that. And I want to try that. So I think first and foremost, figuring out what therapeutic approach kind of really jives with you, makes sense to you, aligns with how you feel like you're experiencing your trauma and what would help you. I also, just one more note on that resources page at the bottom, to my favorite approaches, I put links to YouTube videos. I personally like a good YouTube video to kind of find out, well, what is this about, more than just reading it. So that's there. Once you do that, when you go, Psychology Today is a good go-to platform to look up providers. You can look up trauma providers, but then I start to dig in. Do they say that they do internal family systems? Do they say they do epigenetic counseling? Do they say they use EMDR, which is a common go-to approach, or narrative therapy or something like that? Because you can list 75 things that you're an expert at, but if there's no depth to it, if there's no certification, they will list it. And then the other thing that I think is super important, because it's all relational, is you have to trust that person. They actually did a study, which approach is the best, right? And what they found was it was less about approach, although there is a small portion that's about approach. It was more about the relationship. And do I believe that you can help me, right? Do I have hope that you can help me? So reading that bio, seeing if it jives with you, do you relate to that person? Does that sound interesting? If you like yoga, like you do, those types of things, you can find therapists who also like to do more somatic types of things. They like yoga. And then if you go see the therapist and you're like, I don't like them, or I don't feel safe, or I don't feel heard. That's so important. I've talked to people who are like, yeah, I'm continuing to see them. I mean, I really don't feel like they get it. Find somebody else.
Find somebody else,
right? I mean, that therapist is not a judgment against the therapist. The therapist may be great for a whole host of different people. They're not a fit for you, and that's okay. Move on sooner rather than later. It gets harder and harder. I think I've even had difficulty where I've worked with somebody for a really long time. It's like, it's no longer helpful, but I don't want to hurt their feelings, or,
right.
Don't be responsible for your therapist. The therapy's for you. So I think those are the key things.
Perfect. Well, I made some notes on those links and whatnot, so I'll make sure to put those in the show notes for everybody so they can click on them easily. I know that the people listening to this podcast are interested in just improving their health, right? They've come here because they want to hear more about women's hormones. They want to know maybe why they're feeling off, or what kind of imbalances are out there. And I know a lot of the women listening to this are women who embrace exercise. They embrace learning more about nutrition and these holistic methods. And so if you're a woman like that, a woman like me who's listening to this podcast, and you're thinking, I don't know if this applies to me, or I don't know if I'm ready for this yet. Of course, everything is in your own timing, but at the same time, I can speak from my own experience that working on the outside of you without working on the inside of you will leave you constantly struggling and constantly like beating yourself into the ground. Sometimes it really is as simple as going deeper and going more internal, for the external to make sense and for the external to happen. So we could go a lot of different ways with that, but I just wanted to say that I hope this speaks to a lot of people listening on this topic of really just, it's not necessarily about the method. It's not necessarily about the approach. It's not necessarily any of that. It's just, are you willing to do the work, and are you willing to sit in these feelings and be able to sort of just unleash something within yourself to understand your triggers and your body and how all this manifests itself in your life. So I've been so grateful for our conversation today. I want to make sure that we point people to the book, and also anything else that you want to send people to. How can they get a hold of you if they want to? I'll let you sort of give us all that.
Well, it's simple. You just go to www.resolvetorise.com. There's a few places within the website. You can just click on a link and send me an email. Happy to receive an email from anybody who's interested. That's probably the very best way to get kind of straight to me.
Okay, perfect. Got it. Okay, well, thank you so much for being on the show today. I know there's going to be so much insight gleaned from this episode. Thanks to everybody for listening, and we'll talk again soon.
Thank you.